The Patriotic Front vision for health is what is now internationally known as universal healthcare coverage. The term universal health coverage has become the password, as it were, but this is something that we have believed in for a long time. It is not new. It is twofold. First, that there should be coverage of health services across the whole country, independent and separate from the geographical limitations that may be imposed on us. Secondly, there should be quality. So UHC is equal to quality plus universal spread.
Zambia's 6th National Development Plan states its vision for health as equitable access to quality healthcare for all by 2030, with the goal of improving the health status of the Zambian people in order for them to have productive and fruitful lives. Universal health coverage is defined as ensuring that all people can use the preventative, curative, rehabilitative and palliative health services they need of sufficient quality to be effective, while also ensuring that the use of these services does not expose them to financial hardship.
Universal health coverage is the most powerful concept that public health has to offer, because this is the mechanism to implement the right to health, to implement equity.
In 2012, global support for universal health coverage gained strong momentum when the UN General Assembly unanimously adopted a resolution emphasizing universal access to health coverage as an essential element of sustainable development. Countries throughout the world are actively striving to attain this goal. In achieving universal health coverage, countries need to take 3 primary things into account. Who is covered? Which services are covered and at what level of quality? And how the services are paid for. In Zambia, private citizens spend a substantial amount on health services. Some people are forced into poverty as a result of these high unexpected costs. Many never seek the care that they desperately need, either because it is not available to them or because they fear they will not be able to afford it.
In fact, health problem ninayo manja pakozi na problem ya menso, so mayo paka kwenda hospital lapeza my expensive, so I'm still looking for money.
Nezenda nda clinic na dwara mara, so bananimbea ka description ko gula mkwala, so nizebe ko chusandrama, so nambo sakila until naipeza na shitako kapiswe somewhere.
Zambia took an important step towards universal health coverage by abolishing user fees at primary health care facilities. This has improved access to essential primary care services, but more can be done to increase the current quality of primary care services, as well as to increase the accessibility of higher levels of care when needed. The goal of the National Social Health Insurance is to ensure universal health coverage and make quality services at every level of care available to every Zambian.
Universal health coverage is, something that needs to be homegrown. What do I mean by that? It is up to the political leaders and the citizens of a country to decide on how to start and then how to progress. There is no one-size-fits-all model. Countries must take into account their, historical development, their health system capacities, and also their ability in terms of the speed and the scope of coverage to move over time.
In recent years, the government of Zambia has significantly increased funding for the health sector. Despite these increases, there is a need for more efficient and equitable ways to cover the demand for quality health services and to increase access for the people of Zambia to care at higher levels. This investment in health will ensure an organized, efficient, equitable and more productive society, a better Zambia. One of the strategies proposed by the government to increase the investment in the nation's health is to set up a well-functioning national social health insurance scheme. The government of Zambia is currently engaging in broad-based multi-sector consultations in order to inform this potentially key policy decision. So what is National Social Health Insurance, and how would it bring us closer to our goal of universal quality health coverage? National Social Health Insurance is a scheme in which beneficiaries, young and old, sick and healthy, rich and poor, make advanced contributions based on their ability to pay and regardless of their health status. Employers and the government would also contribute to the pool. Contributions by vulnerable groups are subsidized by the government. Upon illness, benefits are equally available to all beneficiaries. Beneficiaries are able to access a comprehensive benefit package through accredited and contracted public and private health providers. Preventative, curative and rehabilitative care would be included in the benefit package. No exclusions would be made based on pre-existing conditions or income level. Your insurance coverage would not be dropped in the event of illness. The accreditation system would ensure that quality standards are upheld at our primary care centers and higher levels of care. Beneficiaries would not pay any fees to the health provider at the point of service. The National Social Health Insurance Fund would use this pool of funds to pay the health providers directly to cover the costs of health services included in the benefit package.
We consider that health insurance is an important part of a total reorganization of the way in which healthcare is financed. So health insurance is part of that reorganization. It contributes by benefiting from the contributions of all those members of society who have the capacity to pay for the services, and balancing this with those who do not have the capacity into the responsibility for society and not responsibility for the individual. Of course, the benefits are very clear. If you can find a system through which payment is made before somebody is sick, the benefit is that on the day that person is sick, the issue of money will not arise, should not arise. Solidarity with or without money is a fundamental basis for communal healthcare. Solidarity means that those who have are able to subsidize those who do not have. And every society has got the two components. Solidarity is a fundamental principle, and it does not matter whether we are talking of money or our ability in other ways to look after the sick. It is the importance of all of us uniting as society to look after the weak.
For more information, queries or concerns, please visit our Facebook page.